So again, I want to thank, wow, all right, another round of applause for our performers. Very good. Just a few quick thank yous. Beatrice is our supporter. I think it's their third year in a row. They've been great partners with us here at Chess Challenge. I want to thank President Dr. Schulman, Program Committee Chair Subhani Chandra, the Program Committee for putting together this great meeting, and the musical talent of the Training and Transitions Committee who put together tonight. So can I have a round of applause for them? But let's bring up the stars of our show. We'll do one team at a time. Methodist Hospital, New York Presbyterian. Middle section here, Mayo Clinic. Come on, Mayo. And Brooke Medical Center, come on up. All right, folks, so players ready? Judges ready? Audience ready? All right. We randomly picked the first team to choose. Let's go over our categories. Should we do that? Thank you, Mauricio. So for a single challenge, the 5 categories are asthma logic, under a microscope, lung BP, address the distress, and rhyme time. Methodist, you get to pick where to start.
Under a microscope, 100?
So lung histopathology, you said for 100?
Yes.
Well, great. 100-point question. So Eleanor Roosevelt was consumed by this disease. And we'll show it. Brooke.
What is tuberculosis?
Correct, Brooke. TB, caseating granulomas, epithelioid cells. Very good. Brooke, you're first on the board, and you have control where to go next.
500.
Going down to 500.
Under a microscope.
Under a microscope for 500. Okay, it's going to show here. So this tumor we're going to show you is associated with recurrent hypoglycemia. Mayo Clinic.
What is solitary fibrous tumor?
That is correct. Mayo Clinic. All right. Mayo Clinic, where to next?
Asthma logic for 100.
So asthma logic, these have to do with the asthma, often the biologics therapy for 100. Omalizumab targets the high affinity receptor binding site of this inflammatory mediator. Methodist.
Oh, I thought we...
Oh, I'm sorry. Who has the board?
What is...
Mayo.
What is free IgE?
Can you repeat that for the judges?
What is IgE?
That is correct.
Or free...
All right, Mayo.
Asthma logic for 200.
Going down to 200. According to the FDA, prior to starting treatment with mepolizumab, patients should consider vaccination against this disease. Mayo?
What is zoster?
Zoster is correct. Increased risk of zoster compared to placebo.
Asthma logic for 300.
And this is great. We have an early career scholarship winner as a special guest who's going to present this question. Please listen until she's finished before buzzing in.
Hi, I'm Suzanne Lee. I'm one of this year's earlier career professional scholarship winner. The question is, when deciding on biologic therapy initiation, difficult to treat asthma should be differentiated from severe asthma by this patient's history key factor.
And we're going to give you it's a two-word answer. One has 10 letters, one has 9 letters. If I did that right. Looks like no takers. Is that fair? Let's show the answer. And we'll show it. Medication adherence. All right. Thank you. Thank you very much.
My goodness.
Thank you. All right. I believe Mayo Clinic still has the board. Thank you. Mayo?
Yeah. Asthmalogic 400.
Back for more for 400. This is the only monoclonal antibody with independent FDA approval for the treatment of chronic rhinosinusitis and nasal polyposis. Methodist?
What is dupilumab?
I'm sorry. You're calling it? Call it.
Yeah, it was us, right? Yeah. Okay. What is Dupixent?
Say again? Check. Can we have more information?
You want the
Yeah.
generic? What is Dupilumab?
That is correct. Okay, great. All right, Brooke, you've regained control of the board.
500?
Closing out this category. So acronym for the phase 3 trial that assessed tezepelumab.
What is Navigator?
In patients with severe asthma T2 endotypes and revealed a reduction in annualized asthma exacerbations, correct. It's Navigator. All right, Mayo.
Address the distress for 100.
So these have to do with ARDS for 100. The landmark ARMA trial that randomized ARDS patients to tidal volumes of 6 versus 12 cc's per kilogram of Methodist?
What is ARDS-NET trial?
Sorry, that is incorrect. Did someone buzz in? No? Okay. So the landmark ARMA trial, 6 versus 12 cc's per kilogram of predicted body weight, found this absolute mortality difference. Is that time? So no takers. Audience, yeah? All right. We'll show it. 8.8%. Who has the board? Mayo Clinic, your choice.
Rhyme time for 100.
For 100. Okay, excellent. So these questions will have a rhyme in them. This is for 100? Okay. In the ED with the severe COPD exacerbation that is not responding to nebulization, no cause for consternation, decrease in the rate of hospitalization happens with IV administration of this elemental medication. Looking for the medication. Brooke?
What is magnesium?
Magnesium is correct. Brooke?
500?
Same category, rhyme time? Okay. Many factors add to the risks of worsening post-intensive care syndrome or PICS. 28% increase in physical disability, 10-fold increase in dementia, clinically. In older adults, PICS was recently shown to be associated with this factor known.
What's it supposed to be rhyming?
This factor for 500.
Yeah, I think it's true.
No takers, you think, judges, or
Nah.
time? All right, let's show the answer. So socioeconomic status. Who has the board? Brooke, you're still up.
What do you guys want? Whatever you want. You go, Foster.
Address the distress for 200, please.
Back to ARDS. Oh, we have another scholarship winner to present our question. Again, please listen until he's finished.
Hi, Chess Challenge. My name is Paul Chung, and I'm one of the early career professional development scholars. And I'm here now to present to you the Chess Challenge question. The question is, 2 large randomized trials published in the New England Journal of Medicine in 2013 showed no survival benefit in ARDS patients with this ventilation.
Brooke?
Does it want the trial?
Your answer, please, Brooke?
Oh, it's
What is APRB?
That is incorrect, Brooke.
good try.
That's Methodist. Who buzzed in? Mayo? No one buzzed in. Okay, all right. No takers, Mayo or Methodist? All right. So we're done here? So audience? All right. HFOV. All right. Who has the board? You still have the board, folks.
Address the distress for 300, please.
Back to ARDS. A randomized controlled trial published in JAMA 2019 failed to show a survival benefit for ARDS patients when titrating PEEP using this to titrate PEEP. Call it BAMC? Your answer, please.
What is for peak inspiratory pressure?
Incorrect. Mayo or Methodist? Mayo.
What is esophageal balloon?
That is correct. Mayo Clinic, back to you.
Address the distress for 400.
For 400. Okay, so the driving pressure in this patient who is deeply sedated and paralyzed, receiving volume-targeted ventilation, we're going to give you some data, respiratory rate 16, tidal volume 400, PEEP of 10, and a compliance of 20. We're looking for the driving pressure. Ms. Mayo? Mayo?
What is 20?
That's correct, Mayo. Okay, still your board.
I'm distressed.
Rhyme time for 200.
So back to rhymes. When a transplanted heart beats slow, it's very important to know, with usual care you will not succeed, as this medication is ineffective indeed. Hold on, audience. Wait. Mayo?
What is atropine?
Atropine is correct. Yes. So when I know you cover to talk to each other, but when you give your answer, talk into the microphone for the folks in the back. All right, so it's still Mayo Clinic's board? All right, perfect.
300 rhyme time.
Back to rhymes. In a storm with rain and thunder, shelter, there is danger. But even after the storm has passed, chances of worsening increase, alas. To admire a beautiful rainbow, with this condition, stay indoors and use a window. Mayo?
What is asthma exacerbation?
That's correct, thunder, asthma. Yeah. Okay, Mayo.
Rhyme time 400.
So this is our last rhyme for this board. All right. Oh, it's an audience giveaway. All right. Okay, so, all right. So if someone gets this answer correct, then someone gets a valuable prize. But if they don't get it, then they don't get anything. All right, so more pressure. All right, there you go. So we can go to the question. All right. If aortic regurgitation is left unchecked, many signs may manifest. This eponym is known to mean systolic pulsations of the spleen. Hold, audience. Looking for the eponym, the sign. I think it's a tough one. You sure? Time's up, but there's a prize. No? All right, all right. You're going to pass? All right, audience, anyone know? What's that? Gerhardt sign, very nice. All right, folks. There's more. Very good. There's more prizes coming. Don't worry. Okay. Where are we at? Mayo Clinic. The board's yours.
What is BP? Can we ask a question? What's BP? I'm sorry. Is there or
They have to pick the category, and then I tell
No,
them, right?
okay.
You have to pick one of the
Let's do
questions
100.
first.
100?
Yeah, 100 lung
Good,
BP.
good strategy. Lung BP is pulmonary hypertension. So for 100, this eponymous echocardiographic finding can be seen in patients with pulmonary embolism. Mayo? Rise of Mayo?
What is McConnell's sign?
That is correct for 100. Okay.
Yeah, 200 lung BP.
An audience giveaway. But they still have to get it right. All right. So if one of the team gets this right, someone gets $200 off. Okay. So, again, pulmonary hypertension category. A leading cause of pulmonary arterial hypertension worldwide is this infection. That was Methodist or?
No.
Methodist?
What is schistosomiasis?
That is correct for 200. And I just throw this, right? Are you okay? You good? You're fine? You good? All right. Patrick? All right, there he is. So again, this isn't the only way we're going to do it tonight, but I guess for this first one, this is how I do it. We throw the hat out, and you catch the hat without getting injured. All right, ready? Okay. Who hold it up? All right. Hey, okay. $200 gift cards there. All right. All right. Thank you, Darren. Okay. All right, who has the board? All right, Methodist, it's you.
Lung BP 300?
Back to pH. In patients with chronic thromboembolic pulmonary hypertension who are not surgical candidates or who have symptoms after surgery, this medication increases. Bamsey?
What is riociguat?
That is correct. Bamsey, it's your board.
Same category, 400.
400 for lung BP. Okay. A skills challenge. All right. All right. Who got this? This is Bamsey? All right. So this is our first of some fun skills challenge. You know, trust is at a premium these days. And we're going to check some trust down over here. So players, you stay here. Bamsey, why don't you come over here? All right. Watch your step. Come off the stage. And is Dr. Chandra here for our first skills challenge? Subani?
Thank you, Dr. Kelly. Can everyone hear me okay? All right, team. So, have you heard of bronchoscopy? I assume you have, yeah? Yeah, fair assumption. So this is a bronchoscopy challenge. And if one of you could volunteer to be the bronchoscopist, please. It's all right. Thank you, sir. And you can come right over here. Your friends will help you. Don't worry. Your teammates will help you. So, during this challenge, you must navigate to and wedge the bronchoscope in the lingula. Here's the challenge. You will do so blindfolded. Your two teammates, though, can help you using only and only their voice. No touching. Yeah? You will have a total of 60 seconds to do this. Any questions? All right, let's blindfold our bronchoscopist. Give him a big round of applause. If I could ask you to have your hands behind, that would help. Amazing. All right, our bronchoscopist is ready. Team, are you ready? Do we have 60 seconds on the clock? Yes, we do. Judge Schwach, are you ready? All right, ready, set, go.
Forward. Advance, advance.
That's it. Amazing job, team.
Thank you.
All right, let's hear it again. Our very first skills challenge. Okay, still BAMC's board.
500?
Of lung BP.
Sure.
Okay. The development of asthma, of acute pulmonary edema during administration of pulmonary vasodilators is suggestive.
What is PVOD?
That's correct. Veno-occlusive disease is correct. Okay, where to?
Under a microscope, 200.
Back to histopathology. This smoking-related disease is of neuroendocrine origin. Mayo?
What is RBILD/DIP?
That is incorrect, Mayo. Did someone buzz in? No buzz. BAMC or Methodist, do you want to try?
Did you finish the question?
Okay, so this smoking-related disease is of neuroendocrine origin.
Nah.
No takers?
Maybe.
Methodist, okay, just the last minute.
What is PLCH?
That is incorrect. BAMC, you gonna go for it or let it go? BAMC, you gonna go for it or let it pass? Okay. Audience? Let's just show it. Small cell. Paucity of cytoplasm for 5-year survival. Okay.
We're thinking too fancy.
We know UIP, right? If I see UIP.
All right, who has the board? Okay.
Is it us?
Emily, can we have Emily? We have security on standby again, as usual? Okay, all right, good. So Mayo Clinic, where do you want to go next?
300 under a microscope.
Lung path for 300. This infection can cause disseminated disease in immunocompromised patients. Who has it?
What is CMV?
Oh. CMV is correct. You got those big owl eyes. Okay.
Under microscope, 400.
Closing out lung. A skills challenge.
We never get.
Okay, so it's Methodist. Who just buzzed in? All right, Methodist, right this way. Congratulations. Watch your step. A little bugs and drugs.
Right, come on over, team. Good luck with this challenge. So, in this challenge, you have to match the bug to the drug that is used to treat it. Now, the drugs are on that board behind you and will be revealed when the clock starts. Before we do that, though, which one of you is a good runner? Who's fast? All right. The bugs, or the photos of the bugs, are in that bin over there. So only the runner gets to run and bring one bug at a time to your teammates, who are going to arrange them on the board as a matching game with the drug. You can rearrange the board as many times as you like. When you are done with it, please shout out final so we know you're ready. And you will have 35 seconds to complete this challenge. We don't even know how many bugs there are. Maybe there's just one. All right, team, are you ready? Dr. Scable and Judge Alam, are you ready? Audience, are you ready? Do we have 35 seconds on the clock? Yes, we do. Ready, set, go. Run. Come on, cheer him on. There. Woo! 5 seconds remaining. 3, 2, 1, time. Judge Alam, or Judge Cable. Correct. Congratulations. Well done, team.
Well done, well done.
There's only one.
It's there. Yeah. The double points are supposed to be.
It's not the answer, this one.
Round of applause. Still have your water? Okay? Do we have a water for him? All right. All right, one more question in first challenge. Back to ARDS for 500, and according to a randomized trial published in New England Journal of Medicine in 2020, ARDS patients had a higher 90-day mortality when this was the minimum oxygen saturation. For 500 points. Judges, no? All right, I think we're going to be out of time. Audience?
95.
Different numbers. The judges are saying 96%. All right, 96%. All right. So good strategy, teams. Okay. First challenge is done. Round of applause again for our panel.
It was higher than 95, I think. Anyway, whatever.
And you're all doing great. Currently, Mayo's in the lead at 2,900, BAMC at 800, Methodist still in the game at 600. Still anyone's game because in our Let it brain. Counting. Easy, easy.
Come on now. Shortest half-life to longest half-life. You can rearrange as many times as possible. or as you like. You will have a total of 45 seconds, but if you're happy with your arrangement before 45 seconds, or whenever you're happy, yell final. However, if they're not all correct, we will tell you how many you have correct, and you can use the remaining time. We will not tell you which ones, we can tell you how many. All right, shortest to longest. Are you ready? Wait right there, wait. Presidents, oh, you look ready. We have 45 seconds on the clock. Judge Alam, are you ready? Ready, set, go.
Just look straight ahead.
Good work.
Oh, yeah. You guys are crushed.
Gentle now. Final, pause the clock. Judge Alam, do they have all 5 right or they have 1 right? Okay, you have 18 seconds to rearrange. Ready, set, go. Ten seconds. Final, pause the clock.
Is that time?
Judge Alam, how many? None. One. Okay, there are only so many options. You have 6 seconds. 4. Time! Judge Alam, what say you? Are you sure?
Should we give the right answer?
We should give the right answer.
So yes, first.
But let's end on a round of applause for our team and for our presidents.
You handled it with great. Great job. That was so hard.
The first one that was the longest, I think. Okay, that's fine. Whatever. Okay, let's on the floor.
Wow. All right. Very impressive. Judges, where were we? Mayo Clinic, you have the board still.
All right. We got to get
great
away
effort
from
out there.
Music City, 200.
Music City. Questions related, at least tangentially, to Nashville. So while we're in Nashville, this is the gold standard test that can prove a diagnosis of non-alcoholic steatohepatitis NASH.
What is
Yeah.
liver biopsy?
Liver biopsy is correct for 200. Back in the game, Mayor. What's next?
Yeah.
Music City, 400.
For 400. In 1949, former President James K. Polk died in Nashville from this waterborne bacteria that secretes AB5 toxin. Hold on, audience. And no takers? Audience, quiet. Is that out of time? So out of time. Oh, we're good, right? No. Audience? Cholera is correct. Vibrio cholera. We'll show the answer.
I didn't know it.
All right. Mayo, you're up.
Yeah.
Counting for Music City.
Music City, 600.
Another early career scholarship winner. Listen to the full question, and here we go.
Hi, I'm Malvika Kaur. I am one of the 2022 Early Career Professional Scholarship winners, and this is my question for you today. In 1972, the late pulmonologist and professor of medicine at Vanderbilt, Dr. Richard Light, first published his eponymous criteria in this medical journal.
Audience, quiet. Looking for the journal name. Mayo Clinic.
What is chest?
That is incorrect. All right, any takers? Is that time? All right, looking for Annals of Internal Medicine. All right. Mayo Clinic, you still have the board.
Sure. Let it brain 400.
Back to neurocritical care. According to the Neurocritical Care Society, before determining prognosis in patients with devastating brain injury, observation is recommended for this. Bamsey?
What is 72 hours?
That is correct, 3 days. Bamsey, you have the board.
Yeah.
Brain for 600, please.
An audience giveaway. All right. So if you get this right, if someone gets this right, someone pre-selected here gets a huge prize. Okay, let's go. The question here is, I can read it? All right. So this puffy syndrome is also called spontaneous occlusion of the circle of Willis, looking for the term used to describe it. That's Mayo? Mayo?
What is Moya Moya?
Moya Moya is correct. And I can't see with the lights, but if you're center right, fourth row, 2 in, you're winning a $600 Seek online library subscription. Stand up, sir. President Schulman, if it was you, that would have been suspicious if it happened to be. All right, good. All right. All right, it's still Mayo Clinic, you have the board. Congratulations, and thank you for winning a prize for our great audience.
Counting sheep, 600.
Back to sleep. This shown breathing pattern is associated with opioid intake. Who is it? Methodist, right? What's the breathing pattern?
What is Biot's breathing?
Biot's breathing is correct for 600. Methodist, you have the board.
Yeah. Amnusticus? No.
Aericur defectum 200.
So Eocure defectum, this is a liver disease category, is that right? And folks in the back, if you can keep it quiet just for our players up front, and we're doing 200. Okay. So hepatic encephalopathy is commonly associated with this molecular compound. Bamsey?
What is ammonia?
Ammonia is correct. Bamsey, you have the board.
1,000. Liver.
Liver for 1,000. Okay. Whoa, all right.
Should we discuss?
All right, folks, so if someone gets this right, we can do this? This is okay? All right. All right, so, this is a tough one, though. All right, can I read it, Mauricio? Okay, buzzer's ready. A 2002 study of hepatorenal syndrome patients found a decrease in creatinine, an increase in atrial pressure, and suppression of the renin-aldosterone system if treated with these 2 medications. We need 2 medications.
That's 1,000 points.
Methodist, right? Methodist?
What is lactulose and rifaximin?
That is incorrect. Bamsey?
What are norepinephrine and artreotide?
That is incorrect. Hold on. Audience quiet. Mayo still has a turn, right? Mayo, do you want to pass or do you want to try to go for it?
We're going to pass. We think
You're going
we
to
know,
pass.
but we're going to pass.
All right. So Mayo's going to pass. Mayo. Is that what you were going to say? All right, good strategy.
Half of it.
Okay, thank you. Ooh, okay, perfect. So folks, again, it was a tough question, but thanks to the generosity of chess, let's see. Do we have another hat to catch? Far left, 6th row, very end, wins a $400 complimentary 2023 postgraduate course registration. So this here, can you stand up, 6th? Who's in the back there? Darren, pick somebody for a prize. All right. Thank you, chess. Okay. All right, where to? Bamsey? All right, Bamsey, where to?
Liver for 400, please.
In non-varicose bleeding, cirrhotic patients, a 2019 randomized trial showed the use of this test to be associated with fewer blood product transfusions without... Bamsey?
What is TAG?
TAG is correct, or ROTAM. We'll show that. For 400. What's next?
Liver for 600, please.
For a skills challenge! Now hold on a second. Okay, so, as an expert, pulmonary critical care sleep, you're often asked to provide consultation. So we need you to provide a consultation over in Dr. Frankenstein's laboratory over there. So please step over here.
Hello? All right. Yes. Is that good, Patrick? Can you all hear me? Amazing. All right, team. Welcome to Dr. Frankenstein's lab. And in true Frankenstein style, there are 3 body parts under this table, and you have to perform 3 procedures, 1 on each body part. I'm going to ask you, before we reveal the procedures, to please pick 1, 2, 3. Each of you will attempt 1 procedure each. However, if you like, you can swap with a teammate who has not yet done a procedure in this Frankenstein challenge. Okay? Each procedure is worth 200 points for a total of 600 points. You don't have to successfully complete a previous procedure in order to move on to the next one, but we hope you do. Okay? And I'll explain each procedure as we go along. Who's going to go first, second, and third? Please stand in order. Amazing. Judge Schwach, are we ready to reveal the first challenge? All right, let's do it. You have to place the single lumen central line using ultrasound guidance within 90 seconds. All right, I see 90 seconds on the clock. Team, are we ready? Judge Schwach, are we ready? All right, ready, set, go. making an attempt. Wires in. Great concentration. Don't let anybody distract you. Forty seconds remaining. 40. Hi. $30 seconds. No worries. Plenty of time. Five, 4, 3, 2, 1, time. Judge Schwach, what say you?
No aspiration.
Sorry, team, no worries. You can still get 400 points in this challenge. It's pretty good. All right. Who's up for challenge 2? Very good. All right. Let's reveal our second challenge. Knowing some rescue techniques for an airway is really important. So in this challenge, we would like you to place a supraglottic airway and then, using the ambu bag, give at least 2 breaths that demonstrate that the lungs inflate. You will have 35 seconds to complete this challenge. Are you ready? Is the audience ready? 35 seconds on the clock. Judge Schwach, are you ready? Dr. Frankenstein always looks ready. Ready, set, go. Nice double fill. 20 seconds remaining. Completed. 10 seconds remaining on the clock. Congratulations. It's 200 points. All right. Our third and last challenge in Dr. Frankenstein's lab. Yeah. Some rearrangement in the lab. All right. Judge Schwach, are we ready? So, in this challenge, we would like you to aspirate pleural fluid using ultrasound guidance, just using a needle and syringe. And once you have the fluid, please hold it up for everyone to see. You will have 45 seconds for this challenge, playing for another 200 points. Any questions? No. You look ready. We have 45 seconds on the clock. Judge Schwach, are you ready? All right. Ready, set, go. ...25 seconds.
Victor.
Congratulations, team, for being such good sports. Well done.
All right. Nice job, fellas. Please. Congratulations. Congratulations. Are you feeling any better? Victor Test, ladies and gentlemen. All right. Thank you. Wow. All right. Judges, where are we now?
Liver for
And
800.
quick round of applause again for Subani, the Training Transitions Committee, for putting these together. And for all our professional fellows, still cool under pressure. Congratulations, everybody. All right. Bamsey?
Liver for 800, please.
This is liver for 800. Is that right, Bamsey? Okay. So treatment of acute liver failure due to the most common toxic ingestion is determined using this nomogram. Looking for the nomogram. Audience, quiet please. Time is up, audience. Rumac, Matthew nomogram. I think they got that over there. Bamsey, where to next?
Malicious affairs for 200.
Malicious affairs, these are malignancy-related questions. Okay, for 200. Audience, just so our players can hear. So, the malignancy picture here occurs decades after initial exposure of this mineral fiber. We're looking for... Who's up?
Yeah.
Bamsey?
What is asbestos?
Asbestos is the answer we're looking for, correct. All right. Bamsey, it's still your board.
Malicious affairs for 400, please.
Okay. Guys, I hear that if we don't lower the volume, they're going to close the bar. I don't know if that's true. But just, all right, bear with us. It's still all right, where to? Oh, it's a new guest speaker, another early career scholarship winner. Let's take a listen.
Yarley. I am one of the winners of the 2022 Early Career Scholarship, and my question is the following. In 2021, the USPSTF updated their lung cancer screening recommendations to include patients with a 20-pack-year smoking history in this age range.
Is Mayo? Mayo.
What is 50 to 80?
50 to 80 is correct, Mayo. Mayo, you're back in control.
Malicious affairs, 600.
Back to malignancy for 600. This is the lung cancer stage for a patient with the shown left upper lobe nodule, positive EBIS sampling of the indicated lymph node, and no metastases. And we're going to show it to you right here. This is Methodist? Okay. Looking for the stage, Methodist. We need your answer. Your answer, Methodist.
What?
No, hold on. They can answer, right? Methodist, what's your answer? Quick.
What is
Are you sure?
2B, stage 2B?
That is incorrect. Who buzzed in next? Bamsey, it's you.
What is 3B?
T1C N3M0 3B is correct. Okay, Bamsey.
Same category, 800.
Jumping to 800. Judges, get ready. So squamous cell carcinoma may develop in patients with this disease. We're looking for the disease. Methodist?
What is COPD?
That is incorrect. Bamsi.
What is HPV?
Judges? All right, Bamsi. Yeah. Most commonly 6 and 11 stereotypes. Bamsi?
1,000, cancer.
Closing out the cancer category. So this is the first FDA-approved medication for treatment of unresectable or metastatic HER2 mutant non-small cell lung cancer in the U.S. Methodist?
I don't want to bet it.
Your answer, please, Methodist. That's it, judges? All right, so incorrect. Don't answer. Incorrect. All right. Anyone else buzz in? Any buzz in? No takers? All right. Audience? Let's show it. Trastuzumab deruxtecan.
Breast cancer, but I wouldn't have known.
Or that other name. All right, that other name. All right, who's in control of the board? Bamsi.
Brain, 800.
Still a lot of points on the board. Back to neurocritical care for 800. Audience, please. In a randomized trial published in New England Journal in 2019, we're looking for 3 anti-seizure medications, generic names, 3 independently achieved similar seizure control in refractory convulsive status epilepticus. All 3 drugs for 800 points.
Do it. What are you?
Whatever, we're not going to answer.
Bamsi. Audience, quiet.
What are phenytoin, phosphenotoin, and levetiracetam?
That is incorrect, Bamsi, for 800. Hold on. Any other takers? Methodist or Mayo Clinic? No? Time out? All right, well, let's show the 3 drugs. All right. Bamsi still has the board? All right.
Brain for 1,000.
Finishing out neurocritical care. Do you need help? Where are we at? Okay, for 1,000. Neurocritical care. According to 2022 AHA, ASA guidelines, this is the dose range in international units per kilogram of 4-factor prothrombin complex, concentrate, PCC, for patients with intracranial hemorrhage and an INR greater than 2, looking for the dose range in IU per kilogram. I see a lot of head shaking no. Any takers? It's 1,000 points. Time's up. 25 to 50. All right. They had it over there. Okay, who has the board? Bamsi?
Music City, 800, please.
Back to Music City. Nashville was frozen, blizzard of 1951. But when cooling out-of-hospital cardiac arrest patients in the TTM2 trial, there was no difference in outcomes comparing normothermia to this targeted temperature. Methodist?
No.
What is 36 degrees?
That is incorrect, Methodist. Mayo or Bamsi, do you want to go for it? 800 points. No takers? All right, we're going to show it. Audience? 33.
Oh, you said 33?
No, it's not.
Music City for 1,000, please.
Which category? Music City, closing out this. So, Dr. Georgia E.L. Patton, Washington, the first black female doctor in Tennessee was stricken with tuberculosis. If treated according to 2022 CDC recommendations, a daily 4-month regimen consisting of these 4 drugs is preferred. We need the 4 drugs. All 4 for 1,000 points.
I don't think it is 4 months, right? There's some room for the team. I beg.
No takers?
I'm 100.
All right, big points. They want to be conservative. Let's show them.
See?
Rifapentin, moxie, INH, and pyrazinamide. All right. Who has the board? All right, Bamsey, a couple questions left.
Sheep for 1,000.
All right. Hold on, folks, for 1,000 points. This is sheep?
Yes.
Okay. This physical exam finding is present in pseudo-cataplexy, but absent in true generalized cataplexy. Looking for the physical exam finding, audience quiet. 1,000 points on the line. Time's up, judges. Audience? Got it? We'll show it. So deep tendon reflexes. All right. Okay, you guys good? So last question, I'll go to that. Buzzers ready? Judges ready? Counting sheep for 800. To determine eligibility for a hypoglossal nerve stimulator, this Mayo Clinic? Mayo?
What is DICE endoscopy?
Upper larynx, yeah, it's, yeah.
That is correct. So let's show the answer. And not a candidate if there's that concentric collapse on the right. Okay. All right, folks, round of applause for our players. All right, so currently we have Mayo in the lead at 4,100, Bamsey at 2,000, and Methodist, you're going to play with us for final challenge as well, because you deserve it. Don't they deserve it, everybody? They do. Was there some prize we didn't get to give away? No. All right. Can we show our category? So final challenge. Rare inherited pulmonary diseases is the category, right? Everyone's favorite. All right, folks, this just in. Methodist has been awarded, they're up to 1,000 points. You're up to 1,000 points, Methodist. Congratulations. This is where you wager. Do you have pens? So you know what to wage? Go. Awesome job. And much like our players, you can be our winner as well, social media challenge. We're going to show the question, and if you're the first person watching here or on the stream with the correct answer, and the hashtag Chess Challenge 2022, and Chess Trainees, you're going to win free registration to Chess 2023 Hawaii. So get your phones out and your thumbs ready if you're watching at home or if you're here live. All right, so now we have to collect the wagers, is that correct? All right. Have you figured out how much you want to wager? Okay. And she returned the pen. That's so nice. Thank you. You got it? Thank you. And judges, how long do they have to answer once they see the question? About a minute? Don't turn it over until I tell you. Don't turn it over until I tell you. Okay, turn it over and answer.
We don't have our pen.
What's that? Don't show it yet. Don't show it.
Hey, we need a pen.
It's okay. We can say. No, actually, it's okay. It's okay. Right.
Your name's on the top. Oh. That's okay. And you remember your wager, right? Does it say Mayo at the top? Now it does. Bellows and Profit. Okay. A little messed up. All right. And President Simpson had pointed out that to win the prize, we have to show you the question, which is good. But we wanted our players to get to think uninterrupted, and they've all had a chance to give us their answers. So now you have a chance. Phones ready? Dr. Dankers? All right. So rare inherited pulmonary disease. This disease, autosomal recessive, genetic variant SCL3482, and we show some classic pathology. Judges are ready. Okay, so let's see. Methodist. Well, should we show what the answer is? Can they tweet the answer now? All right. Now, Mayo Clinic, Methodist, you had 1,000 points. What was your answer?
What is pulmonary alveolar microlithosis?
So you got Pam, and what did you wager? All 1,000. Let's hear it for Methodist. Up to 2,000. Okay. So Methodist up to 2,000. Okay. Brooke, you were in second place with 2,000. What was your answer?
Pam as well.
They got Pam. What did you wager?
Nothing.
0. Oh, good stroke. Okay, so stay at 2,000. And Mayo Clinic, what was your answer?
We had no answer.
Thank you, Chess.
Thank you.
Thank you, Chess, was their answer. And your wager?
$22.
$22 for Chess 2022. All right, we have our champion. Again, thank you, Chess Program Committee. Thank you, TNT Committee. Let's thank our players real quick. Yes. So every one of them champions. And for all of you for actually showing up and making this the best live event in a long time, give yourselves a round of applause. Enjoy the rest of the meeting. Okay, so we have a tie. Team Methodist, can you come forward, Methodist? All right, right here, front and center. T&T committee, can you come on up? All right. Who's next? Ms. Brooke? All right, and then finally, and folks, may I have the Training and Transitions Committee up here? President Schulman, come up here, please. Mayo Clinic, do you have a program director here or people that love you in the audience? Hey! All right. Okay, everyone get in the front here. Ladies and gentlemen, introducing the Chest Challenge 2022 World Champions, Mayo Clinic. Come on up.
I'm so embarrassed.
Team, can you walk up in the front, please? Yeah.
What did you think?
I think they were hard. Yep. So again, our Mayo Clinic, congratulations, well deserved, so professional. You get the $5,000 check. You've had this wonderful trip to Chest, but we actually have a special presentation. The Chest Challenge trophy is named the Rosen Cup in memory of Mark Rosen, a Chest Challenge founder 22 years ago, loved by many. And we have Mrs. Rosen here to present the trophy. And so thank you for sharing, Mark, with us over the years. And back there, you said something about the questions tonight?
They seemed a little difficult.
They were very difficult. They were very difficult. So, Mrs. Rosen, if you could do us the honors to present the Rosen Cup for our loved one, Mark Rosen, to the Mayo Clinic program. All right, congratulations, everyone. T&T, come on up here, folks. Another picture. Don't go. Another picture. Come on up, everybody. These are folks. How do you feel as the program director?
Extremely proud.
Would you recommend playing Chess Challenge next year?
Absolutely.
And yourself?
Very happy.
It wasn't so bad, was it?
It was great.
Congratulations.
Thank you. Very
All right, okay.
We're now going to Disney World.
Hey, all right, Disney World. Ready? All right, folks, you have a picture? All right, on three, we'll see. All right, on three, Chess Challenge. 1, 2, 3. Chess Challenge! Oh, and then TNT forever. The Training and Transitions Committee is TNT. Ready? We're going to say all right. 1, 2, 3. TNT forever. Good night, everybody. Thank you so much. I'm happy for you. You've always been a great sport.